So wow, we have hit number 10, and what an honour it is to have Dr. Ravi Padda.
Thank you for having me.
No, I'm excited. I've been wanting to do a podcast with you for a while. Me and you talk all the time.
Yeah.
And happy birthday from the weekend.
Yeah.
What did you get up to on your birthday?
So actually, I was working half of the day.
Were you?
But the second half of the day I was spending with family and just chilling.
So let's get straight into it. So the first thing I really wanted to get into is how have you become such a well-renowned cosmetic dentist? What's your training? What's led you to come to Abbey House Dental?
Okay. So first and foremost, let me just thank you. One, for having me here, and second, for that compliment. I'm not sure whether I can live up to that, but no, I do appreciate it. So I think it's just experience over the years of practicing dentistry, refining your craft, making mistakes, but correcting those mistakes. And then, just adding one extra kind of accolade to your skill level, starting off with your general, but then adding on the composite bonding and then Invisalign, the easier cases, and then the more difficult cases, and then just kind of bringing that all in together through experience of practicing it and treating it for patients, really.
And what training did you have to do to get to be able to do all this? What kind of courses have you been on? Where did you qualify? So
qualifying was actually in Czech Republic. So Eastern Europe, spending 5 years over there, which was amazing. Met some amazing people. The food there is great. The weather there is great. And obviously studying at the same time as enjoying ourselves.
So just out of interest then, so doing a degree in Czech, is it similar to how the UK system is? Did you find much differences to when you came back here?
It was quite different, to be honest with you. When we were over there, first difference is the degree. So there's a lot of medical kind of driven studies over there. We had to not just study dentistry, we had to study pharmacology, pathoanatomy, internal medicine, obs and gynae, pediatric medicine as well as dentistry. So there was a lot of medicine in there, which kind of helped me treat patients because I can understand how the mouth links to the whole body. And coming over to the UK, we were pretty brand new when we were coming over, as in foreign dentists, as we were called, coming to the UK then. And GDC needed some kind of help and guidelines based on that. And a lot of it, to be honest with you, I had to kind of figure out myself. So I did have a mentor in Birmingham that helped me kind of understand the NHS system notes, because all of our notes over in Czech Republic were in Czech.
Oh, right.
They weren't in English at all.
Wow. Yeah.
So I had to kind of...
So the lectures in English?
Yeah.
They're in English.
Yeah. But you had to learn how to speak Czech when you're over there.
So you can speak Czech?
Yeah. I've literally only had 2 patients in the UK.
Yeah.
One, bless her, a really old elderly lady who needed a new denture. And I think she was quite shocked to see me speaking in Czech, asking her, where does it hurt? Do you need a new denture or whatever? So that was quite interesting. And but the rest of it was all in English. So when we came over to the UK, one of my actual first courses was to understand how to write notes. Literally, how does the English system work? And just carrying over our skills and bringing it to the UK. Yeah.
But you grew up in England, and so it's just for university.
100%, 100%.
And then what kind of courses and mentors have shaped your career then to get to this stage where you're kind of confident and competent in doing all this dentistry?
So when I started with my FD training, I was very lucky in the practice that I started in Birmingham, which I'm still at now, looking after the patients that I've been looking after for at least 8 years now. I had, I'd say, 3 or 4 more senior dentists that I'd literally just knock on their door or just message them and say, look, I've got this case. Do you mind just kind of letting me shadow your cases if you can come in and help me? There was 3 in particular that really helped me deliver that dentistry that I needed to deliver.
Yeah. Wow, that's amazing.
Yeah,
and
really
then in terms of your passions then, what would you say that out of all the things that you do, what do you enjoy doing and why?
My number one thing has to be the health of the patient. I know with the smile and making them look nicer, but just the confidence that some patients have when they're out of pain and they're able to do the normal things that we take for granted. Being able to talk to your friends, being able to go out for meals, being able to not worry about a tooth breaking when they're enjoying a certain particular food that they really enjoy, it's great. And then some patients, you see them kind of walk into the room where they're kind of hunched over, and then literally within a few months they're like, oh, hi Ravi, how are you doing? And I'm just like, you're not the same person. Especially when you take the before and afters as well, and you do the full face shots. You just look at the patient, and in the nicest way possible, you're just like, was that really you? Like, you look completely different. It's incredible to see the transformation of not just the smiles, but how their whole body takes a different form.
Is there a particular case that has taken you back as to the response you got when you changed their smile?
Definitely. And it was actually in Festival Park about a year ago, and I've been treating her for a good year. And yeah, that's literally the patient that I'm talking about when she walked in like this. And I mentioned it to Sam, one of our team, and she was one of the first one of the first colleagues that introduced her to the practice. And I said, Sam, I need you to see our patient and see how she is. So when we did the testimonial at the end of the treatment and we did the review, it was just incredible to see how she just livened up. And just even the way that she was dressing, putting on jewelry, accessories, just the whole demeanor of it. Changed, 100%. The whole patient just was completely different, and that for me just felt amazing, being able to make that person feel themselves again.
And what did you do? What treatment did you do?
So that was an Invisalign. That was a quite a complicated Invisalign. It took us at least about a year, perhaps close to a year and a half. There was an extraction involved in there, so we did have to take a tooth out to make it kind of work. And then it was restoring the health of the gums, restoring a few areas of the mouth that needed a bit of attention because there was a bit of neglect there. And yeah, that was literally it. No composite bonding afterwards. Some whitening, of course, which we included. And yeah, that was. So,
what advice would you give patients that want a smile makeover?
100% just come in for your checkup. Even if it's for a consult, just get as much information as you can. I would shy away from trying to get too much information from online, because there's the TikTok out there, there's Instagram out there. There's a bit too much information because you don't really know what to expect when you're searching online. Just come and talk to one of us. When you do talk to one of us, we do kind of refine it and tailor it specifically to you, so you kind of understand what you're expecting on your journey to a better smile. 100%.
And so, if you had to say what treatment do you think you prefer doing out of everything? Is there one particular thing, or?
I'd say it's a combination. I would love to say it's one thing. So like, I love doing composite bonding, I love doing Invisalign, I love doing the general smile makeover and restoring patients' bite. But I'd have to say it is a collective. I always see our patients not just as, you've got an issue here, you've got an issue there, let's sort that. I see the patient as a whole kind of system. And I think bringing that whole system in together, you can't, in my experience, and I'm sure you'll agree, when you have a patient and you say, we'll do this, this and this, it works much better when you have a set kind of protocol. So my protocol would be, if you're in pain, get you out of pain. If you've got any disease, get the disease rid, and then aligning everything, making everything brighter, and then just bringing back that function. So for me, it has to be
sorting out the health and then working on the aesthetics.
100%. For me, it has to be like a whole package of making that patient just feel themselves again, from the ground up.
So if I had to ask you 5 things, I'm a patient now and I'm looking for a cosmetic dentist. How would I choose a cosmetic dentist? What 5 things would you want to know as a patient?
So one has to be experience. If the dentist that you're seeing hasn't got the experience, perhaps they might be great, but obviously it takes years of practice to do that. Second of all, do you like them? Do you get on with them? Of course, each dentist is different. They might have an approach that is not for you, or they might have a direct approach where you do really prefer that person tailoring it to you. You're able to have an open and honest conversation with them, and you feel comfortable in their presence.
Yeah.
That's extremely important, that patient feels like you're just a friend. You're not necessarily the clinician at the other end of the room. Because one of the main things that we do get from patients is literally the line, "I hate the dentist. I don't like to come to the dentist."
Most commonest phrase we get, isn't it? Every day.
And we're literally like, "Hi, my name's Ravi. Nice to meet you. I understand you hate me, but please let me introduce myself and see how you are." So that would be one. Skill level, rapport, and just kind of building that relationship with the patient and just seeing how they feel. Even after the first appointment, I'm fairly confident when I know a patient's going to be on board with what you're saying. And then literally in that consultation, having the extra 5 minutes, having that extra 10 minutes, worst case scenario if it needs to be, to have that conversation with them so that they understand what's going on. Because obviously for us, we've been in the dentistry industry for years. So they need to have like a quick crash course in what we know in the space of that consult so that they feel comfortable going forward.
Yeah, and I think the team as well, having the team on board is usually, if the patient interacts with the whole team and they can see that the whole team are used to doing this on a regular basis, and you can see online that there's before and afters, you can see that what kind of work that a practice does. I think it builds up that kind of foundation as to know that this is the practice I want to do it at.
100%.
Because every dentist claim that they can do it.
Yeah.
But have you seen it as a patient? And I think that's really, really important, is to know what education, what background, what's the team like, I think is really, really important.
100%.
So going forward into kind of some of your other interests, out of many dentists, we have plenty of hygienists at the practice, but you're one of those unique dentists that enjoys doing and treating gum disease. Tell me a little bit about that and why.
So going back to the start of the conversation, the general health, I try not to scare patients too much, but we know how important your gum health is. Literally, your mouth is the entrance to your whole body. So if you don't respect that, it's not going to respect anything else. So we also know that our body is driven, ruled and controlled by a lot of bacteria. If we're not looking after that bacteria, it's going to have an opposite effect on our body. So the things that I try to say to patients initially is just to get them on board is make sure you're using an electric toothbrush, make sure you're flossing, make sure you're seeing the hygienist regularly, but also your diet. It's massive. Now you probably see online all these different Instagram reels. You'll see how different foods like your McDonald's, your KFCs, obviously all of us have had them at some point in our life, but you know how much it's going to damage your gut bacteria. And improving your gum health will massively improve your energy levels, your reducing the risk of diabetes, Alzheimer's, dementia, heart disease, and that's literally just to name a few.
And I'd say in the last 10 years, all that research has kind of been come out. It's been evidence-based, and 100%. We know that it's all linked, isn't it? But as a profession, we've always used that hygiene team who are phenomenal. We'll be doing some podcasts with them soon as well. But there's very few dentists that have that passion to treat gum disease because we've got such a good hygiene team. But you enjoy doing the treatment as well, don't you?
Definitely. Yeah, definitely. I like to kind of work alongside the hygiene team because you're 100% correct. Hygiene team is amazing, and I'm lucky to have experience from other areas of the UK as well, specifically Staffordshire. But I always find that the correlation is the healthiest patients in their energy levels, how they feel, and just general checkups over the last 5+ years. The ones that are the healthiest are the ones that have got a hygienist on board and have had potentially some sort of gum disease treatment in the past as well.
I wonder if it stems from your degree then, because you said that you did a lot of medicine within your, we do as well, but I think it sounds like Czech does a lot more, and is that kind of, because, gum disease is the entry point into medicine, isn't it, for us as dentists, and so do you think that stemmed from it?
I would definitely say so, yeah. To be honest with you, I can't compare to the UK system because I haven't been kind of exposed to it, but from my side, 100%. Yeah, I'm very lucky to have learned a lot of information about your general body and understanding how it all ties in, but it's also your personal experience as well. So obviously, unfortunately, some of us may have family members with diabetes, we may know family members or patients that have had Alzheimer's or dementia, and we know that the effects of reducing that and how patients' symptoms have got better. Me personally as well, not specifically any of those, but just being on a health kick yourself.
No, I mean, within our own communities, the kind of Indian community, Asian community, gum disease is statistically higher, isn't it? So
definitely.
I think it's good that some of us are pushing forward and trying to improve that.
For sure.
Where do you see your career going over the next 5 years? What do you think you're going to be doing more of?
I have an idea. I've got a little framework in the back of my mind. I don't like to set it in stone because I like to see where the universe kind of takes me and what the different things are going to be. But 100% I want to go down the whole holistic biological route of treating that patient as a whole. I know from my personal experience of looking into holistic dentistry, looking into vitamin support, making sure that you got your vitamin D, like you mentioned about coming from an Asian background, living in the UK with the amazing sun that we get for 1 month a year. Our vitamin D does lack, and obviously with COVID, we did have a lot of, thankfully, support and research on how vitamin D can increase your risk in certain viruses. So being able to bring that vitamin support, being able to bring patients to understand that your mouth is not just your mouth, it's your whole body.
Well, there's so many people, I mean off tangent here, but vitamin D, there's so many people that are deficient in vitamin D. There's been some more and more evidence coming to light that implants have a high failure rate with people with deficient vitamin D. So I know some people within the UK and across the world are testing people for vitamin D and giving vitamin D supplements prior 100%. To implant surgery. So we as a practice we were discussing that in the implant meeting about bringing that in within the new year as well.
100%.
But yeah, sorry, go back to back to what we were chatting about. So the vitamin side, and what else then? Where else do you see yourself going?
So there's a couple of other things that I'd like to kind of learn about a little bit more. I know I've mentioned it yourself. One thing is use of more ceramic and obviously composite. We know I do not, very rarely, maybe 0.1% touch amalgam at all. We know from recent legislation that it's been completely, it's going to be completely eradicated from Europe and hopefully the UK soon enough as well because of the toxicity of it. So yeah, just being able to use materials that are harmonious with our body and that are not going to be causing any interferences.
And we spoke about using the ceramic implants, isn't it, down the line, and we've done a few of those on certain patients that have requested it, but it's not common practice. The standard material is always titanium. So interesting. And okay, now moving forward and thinking about how the world of dentistry has changed digitally with AI coming. Where do you see dentistry going in 5 years? How do you think the workplace of patients and the equipment that we use are going to change over the next 5 to 10 years?
So the first thing I would say is a lot of it's going to be similar because we still need it to be person driven. However, the thing that's going to just make it so much better is already the fact that we have scanners. Those scanners are going to be able to scan a lot more. We know also with the iTero, you've got the different translucencies where you can potentially see cavities before you even take an x-ray. X-rays now, we know there's certain companies out there. I think Pearl AI is one company out there where you can specifically, without you having to diagnose it with your own eyes, it then looks at the contrast of that image and kind of tells you where the cavities are. That's 100% going to be one. You'll probably know more than I will, or you'll definitely know more than I will, but guided implant surgery, AI driven, face driven AI. The feature for Invisalign as well, I tried it out a few weeks ago, which was incredible. Is just getting the patient to speak, getting the patient to say the days of the week, and then seeing how their smile is literally transformed, which is incredible. The fact that you can say to them, look, this is exactly what you're going to look like. It's not even a guess. It's actually what they look like.
And we've been using that for some of our full arch implant cases as well, where we've got taken a little video of a patient talking with what they look like now, and then the AI puts them talking with the teeth in. And I just think that if you can see that as a patient, that then drives you to effectively, you can see the final outcome. And I think you can see the final outcome, or at least a close. And I think a lot of the cases that we do, and we've seen AI kind of overlay it and what it could look like, we're generally there or thereabouts, finishing up the way it looked originally. Especially with Invisalign, isn't it?
100%.
It's very close, isn't it? It's if not better sometimes. If I'm being honest,
it's extremely close to it. Very, very close.
So it's been really interesting. I think we've covered so many different topics in this time frame. We always like to finish off the podcast by giving you a gift.
Okay.
And we choose a book for you that me and Monk think about. And the book that we've chosen for you, Ravi, I can't say it fully because it's The Subtle Art of Not Giving. Now, it's a very inspirational book. I've read it, Monk has read it. Kelly's read it, our practice manager's read it. And it, to us, you've always been that dentist that does his own thing. He doesn't follow the crowd. He does his own thing, and he's very much about what's best for his patients and the best outcome for you as well.
100%.
And I think this book summarises a lot of that. So it is a bit, the wording's probably, it sells when it has that type of wording, but when actually you read the book, it's got a lot of inspiration in it. So hopefully you will read that.
No, thank you.
Thank you so much for coming.
Really kind of you.